Hello and welcome to Physician Academy. Please visit us on YouTube and like our page. Please share this site with others and encourage others to participate. The more people involved, the better this site will be. So today, we are going to talk about gastroesophageal reflux disease, or GERD, and this lecture is meant as an introduction to gastroesophageal reflux. Gastroesophageal reflux disease, also known as GERD or heartburn, affects 10 to 20% of the adult population. Report this as having an occurrence on a weekly basis. Etiology. The symptoms implies the problem with the lower esophageal sphincter. The loss of sphincter tone or incompetent lower esophageal sphincter tone, hiatal hernia. Other causes or symptom or other things related to this would be pregnant patients with which have hormonal changes that affect sphincter tone, recurrent transient or relaxation of the sphincter unrelated to swallowing. Gastric distension is an example. Pharyngeal stimulation is another. Or another one is poor esophageal motility. Other contributing factors that affect the function of the lower esophageal sphincter is gravity. So for example, laying flat versus an incline of 45 degrees. Diet, fatty foods, caffeinated beverages like coffee and soda, alcohol, tobacco, and other foods like mint and chocolate can lessen the esophageal sphincter tone. Drugs, anticholinergic drugs or antihistamines, tricyclic antidepressants, calcium channel blockers, nitrates, and progesterones also can lessen or decrease the lower esophageal sphincter tone. Other things that can affect the tone of the lower esophageal sphincter are obesity or increase in weight. This is caused by an increased pressure on the abdomen, which then applies pressure into the gastric contents, which then pushes on the lower esophageal sphincter. Factors that affect the function of the diaphragm. So anything that's going to affect the way your diaphragm works, again, obesity would be another example, or if there's something that's putting pressure on the diaphragm from below. So what are the signs and symptoms? Heartburn is the most common symptom. It's worse after meals, worse when recumbent or lying flat, classically more common in the evenings. Other signs and symptoms would be regurgitation of gastric contents into the mouth, atypical symptoms often associated with chronic aspiration or symptoms of cough, hoarseness, or wheezing. So those would be other symptoms. Sometimes a patient might present as a chronic cough that they've already been to another doctor or they've been to you and they've been treated with an antibiotic and it's not getting better. They've been treated with cough medicine. It doesn't come better. This has been going on for months. And sometimes they even will show up with wheezing or hoarseness of breath. Another symptom would be odynophagia, nice fancy word for pain with swallowing, so it hurts when they swallow. And a long-term thing would be esophageal strictures from long-standing gastroesophageal reflux disease, and that can present with dysphagia to solids. So diagnosis. What are the criteria for diagnosing gastroesophageal reflux disease? The first thing would be a detailed history. Presumptive diagnosis can be made in the presence of classic symptoms. For example, as discussed above, the classic symptoms of feeling something burning in the chest or heartburn symptoms. Treatment with empiric therapy of a proton pump inhibitor, modified diet, such as avoid the foods that cause the symptoms. That's always a hard thing for me to do. Other diagnosis would be things that would be checked out would be chest pain symptoms. Always need to rule out cardiac cause first. Another way to diagnose this is a 24-hour pH monitor for patients with symptoms and normal EGD. Of course, an EGD is a gold standard with cytologic washings and a biopsy. Biopsy can detect columnar mucosal changes of the Barrett's esophagus. This is a precursor to adenocarcinoma, and then would require EG surveillance every 12 months. A barium swallow is another test that can be done, used to demonstrate esophageal ulcers and peptic strictures. It is less useful than the EGD. Most patients with abnormalities end up with an EGD. So we've talked about the symptoms and etiology. We've talked about how to diagnose it. So the treatment would be the next thing. And the most obvious thing on the treatment is avoid foods associated with the symptoms like coffee, alcohol, fats, and chocolate. Easy for us to say as physicians, hard for our patients to do. It's even hard for us to do. Other things to recommend would be stop smoking, elevating the head of the bed to 45 degrees if possible. This is really important in hospitalized patients, is elevating the head of the bed as a way to prevent aspiration pneumonias. So it's a really important thing. As an outpatient, it's less important, but it's important for our patients as one of the possible treatments for reflux disease. Weight loss would be another thing. Easy to say, hard to get our patients to do. Standard would be, other treatments would be medications, would be H2 blockers or proton pump inhibitors. The H2 blockers that are most commonly used as an example would be ranitidine, 150 milligrams before bed. Proton pump inhibitors are omeprazole or pantoprazole, about 30 minutes before breakfast, and they are usually longer acting, so they last 24 hours. Another thing to recommend for treatment is avoid medications that may cause the problem. If it's possible, change the medications they're currently on. So if they're having a medication that started this problem, if they can switch it off or change how they take it. Barrett's esophagus may resolve with medical treatment, but does require monitoring with EGD as we discussed above. If Barrett's esophagus is diagnosed with EGD, it would require surveillance every 12 months. Last option for treatment would be surgery, laparoscopic fundoplication, always a fun word to say, laparoscopic fundoplication, to repair hiatal hernias or for stricture repair. So this was a basic introduction to gastroesophageal reflux disease. Hope you enjoyed it. And don't forget, visit us on YouTube, like us on YouTube, very important so that we can get our own channel. Please share this site with others and encourage others to participate. Remember, the more people involved, the better this site will become.